Almost every day as the COVID deaths are reported, so too is this phrase.
Underlying health conditions.
Significant underlying conditions.
And who did have underlying health conditions.
They span all age groups.
A woman in her 50s, one in their 60s, one in their 70s and one in their 80s.
And all those individuals had some significant underlying health conditions.
And there was a woman in her 70s who had underlying health conditions. A man in his 50s also had underlying health conditions.
Very rare for somebody with no underlying condition to end up in ICU.
Some significant underlying health conditions.
The image it conjures up is a grim one.
An underlying health condition really brings to mind somebody who's sort of lying in a bed, three-quarters dead, clinging onto life by their fingertips.
The reality? Someone with underlying health conditions is almost half of us. 1 in 2 Aussies has a chronic condition of some kind. 1 in 5 of us has 2 or more underlying health conditions.
Cancers that make them immunosuppressed, chronic obstructive lung disease, emphysema, diabetes puts you at increased risk, significant obesity puts you at risk.
Asthma, mental health conditions, osteoporosis, any form of cardiovascular disease. This is all really common stuff that an awful lot of people live with.
Critics say the vagueness around the reporting of these
underlying health conditions
means it's virtually useless, calling for an end to its use in the daily briefings.
This term underlying health issue reeks of a diversion tactic to divert attention away from poor planning or poor government policy.
It's a diversion that could be damaging.
It sort of leads to this idea that the people who are dying of it are other. They're not normal people. They're not run-of-the-mill people. You have nothing to fear.
Worse still, those relegated to the other camp are rendered faceless, expendable. Now those other people are fighting back with the hashtag underlying health condition, putting human faces to the faceless.
We're joined now by Dr. Karen Phelps, the former head of the AMA. Dr. Phelps, why do you want underlying health condition banished from the daily briefings?
Well, this expression, underlying health conditions, is just a tack on to the announcement of people who have tragically died from COVID-19. It doesn't add any useful information. And in fact, I think it could be quite harmful. It could give a false sense of security to people who do not have a chronic underlying health issue. And it could also mean that you are marginalising people, making people feel less valued, that they had some part to play in the fact that they died from COVID if they did have an underlying health condition.
I have to say that part of what you've explained there caught me by surprise. Like, it had never occurred to me, as someone who's watched more of those daily briefings than I would like, that when you are told that someone who died from COVID had underlying health conditions, that was somehow blaming them. I mean, it seemed to me it was only just relevant information that's important to know, because when you have underlying health conditions, COVID can really do a number on you and you're at higher risk.
So, Ollie, you have to think about what is the purpose of saying underlying health condition. What is the purpose of bringing this up in a press briefing? What then is the strategy for protecting these people who are more vulnerable, other than to make them more anxious, whether they've had a vaccination or not? And it's important that we have population data on underlying health issues and specific which ones are specifically related to a higher risk, but it's not helpful at all, and it's particularly anxiety-provoking for people who have an underlying health issue to be hearing this expression day after day.
So I have an underlying health issue, and I have to confess I haven't felt any anxiety about that description. I guess the way I've always seen it is just that it's just providing an accurate picture of what's going on. Now, I take your point about the vagueness of the term, and that's a separate discussion, we can have that. But to me, hearing that someone who's in their 70s and had an underlying health condition died from COVID is a different character of thing to someone who's in their 20s and didn't have an underlying health condition and died of COVID. They're both tragic, they're both deaths, they both deserve respect, but it's qualitatively different. And as a member of the public, I kind of appreciate getting a picture of what's actually happening in that way.
But you're not really getting a picture, are you? All you're hearing is a vague term of underlying health condition. It doesn't have a purpose. What is the purpose of this particular expression? It's just an expression that is used, and it reeks of a diversion tactic to say, well, there's a reason or there's an excuse why these people got COVID, other than poor government planning or poor strategies in place to protect the vulnerable.
Well, couldn't the purpose be
to encourage people who have underlying health conditions to get vaccinated? If we're asking people to put up their hand and come forward to get a vaccine, doesn't that message suggest you can actually get really sick and die from COVID if you have an underlying condition, so there's even more reason for you to get out and get vaccinated?
People with underlying health conditions are well aware that they have a higher risk. They've also been well aware of how difficult it has been to get a vaccination or a vaccination that is suitable for their particular age or their particular condition. So, if you're asking what is the purpose of saying underlying health condition, that's not for me to answer. That's for the government who are making this statement day after day to explain what is the purpose behind this expression, because it is causing anxiety and it is causing difficulty for people who do have underlying health conditions.
Dr. Phelps, it's always a pleasure. Thank you so much for your time.
Thanks, Karen.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.